Everyone, we're going to get started. Some of you have been here before, and some of you maybe have seen me, but I'm Michelle McGrath. We have to use the microphone. We are recording, and believe it or not, we have our recordings on the library website as well as the coalition website, and lots of people do click on the recording. So it's great to have this available for folks if they can't be here tonight. So we are excited to have the last of our April Wellness series this evening. The Coalition, Waunakee Community Cares Coalition, is an organization that's dedicated to keeping Waunakee healthy and resilient. We put on programs throughout the year, work with our schools, work within our community. And the month of April is dedicated to prevention and wellness and mental health. So this evening, we are just excited to have Melissa Olson, who is one of the co-owners of the Psychotherapy Center of Waunakee and one of my former students, which is so exciting to me to see what happens when they grow up and do really amazing things. So she is going to share with us some insight on mental health as well as suicide prevention. So let's give a big warm welcome to Melissa Olson.
Well, hi everyone. My name is Melissa. My co-owner, John, was going to be here tonight, but he was feeling ill and not well. And so he's going to stay back and get some rest and take care of himself, something that we all want to practice in our daily lives. Sometimes when we overcommit to things, or if we have a lot going on, it's really hard to say no, because sometimes our heart might really want to do that thing, even though we're sick or we're not feeling the best. So just remember to give yourself some grace and gratitude as you move forward in your week. So today's presentation is going to be on suicide prevention and how we can help anyone in our lives work through those really tough times and work through kind of what is going on in their world and in their lives and how we can help. The agenda today, we're going to go, well, I did my introduction. But so something I thought that was going to be important for us to talk about today was some of the definitions, because sometimes when people talk about different parts of suicide, at least in my head, prior to becoming a therapist, it was very serious. It was scary. It was something that maybe we didn't want to talk about. We didn't know what to do with it, so why ask? But the thing is, suicide is not black or white. There's a lot of gray area, right? Kind of like you were talking about your friend. You're not quite sure what to do, but you want to do something, but you don't know what. And so hopefully we can give you some help and some guidance and maybe some answers today, okay? And then we're going to look at some skills and tools, some facts, resources, and then we'll open up probably like the last 20, 25 minutes for questions. If you guys have any, we can kind of go over it. So let's start off with intrusive thoughts. Has anyone heard of that before? Just show me with your hand. Oh, sorry. Yep. Okay, so let's try that again. Yep, that's all right. So intrusive thoughts. Who's heard of that before? Yeah. So the difference is intrusive thoughts are those things that pop in your mind. I know when I was a mom, a first-time mom, I remember thinking, oh my gosh, what if I drop my baby? What's gonna happen? Wait, why am I thinking that? That shouldn't be a normal thought. Why would I ever want that to happen? So that's a good example of someone having an intrusive thought. So it's unwanted. You don't want that thought. It's something that just kind of popped in your head, maybe unrealistic. Then if you have a suicidal ideation or a suicidal thought, that's more intentional. That's like, I don't want to be here. I want to go to sleep and never wake up. I hate my life. It's a lot more serious. It's very intentional. And then you have the actual act of suicide. And that is the instance of taking your own life voluntarily and with intention. I have a small little video. It's about 4.5 minutes for us to share together today. So I'll come over here and sit with you guys while we watch this, but I need to get out of this. So when I do presentations, I like to get a lot of like engagement. Maybe you're picking up on that, but I think it's important for us to retain the information and learn. So was there something in that video that kind of caught your eye or that caught your ear, made you kind of think about something a little bit differently? What about the question of directly asking, do you have thoughts of killing yourself? And actually using those words. What does that sound like to you? Does it sound scary? Yeah. Yeah. I think it's important to remember, like they said in the video, that even if you were to ask them that question, you're not going to put ideas in their head. If they were already thinking about it and you're picking up on what's going on in their behaviors, which we'll talk about, that right there is them asking for help. You know, whether it's them drinking more or staying in their room more, staying in their bed more, spending more money than usual, not showering. Those are all going to be key signs of things that kind of give you that permission to go in and ask if they're doing okay. Let me get this back up. So this infographic is from the National Institute of Mental Health, and they really talk about, can everyone see it okay? Okay. So if you have a friend or a family member and they're talking about wanting to die, feeling of just like shame or anger or embarrassment, or being kind of just like a loner, maybe feeling like a burden. They also show here feelings of being trapped or empty or hopeless. Hopeless is a key word here because hopeless, when someone loses hope, that's a big sign. That's a really big sign when they start to lose hope in life. Feeling extremely sad or anxious, rage, agitated. Those could be any of the different things that they might be feeling or sharing or what they might be talking about. Then we go into some of the behavior. So making a plan. That's going to be the key thing to ask. If they say, yes, I'm having suicidal thoughts, the next thing is to not leave them in that moment, but to also ask, do you have a plan? So do you have a plan? If they're taking dangerous risks, if they're kind of like we talked about earlier, kind of being a loner, kind of wanting to be by themselves, maybe not coming out of the house very much, using drugs or alcohol, eating or sleeping, and just really having a wide array of moods, like up and down and crying, then anger, and really paying attention to that. So the text, the 988, or texting the phone number 741 are going to be two key numbers for you to remember or save in your phone. And over here, I brought some magnets to your place of work, your kitchen, friend's house. It's really important just to have it on the fridge. You know, if your kids are over and their kids are over and they're going in to grab a drink and they just that little image of they're able to kind of go back to that. So that's a little bit smaller. So I'll do the same thing with this one. So this is going to be the process and what to do. So the first thing is we're going to ask. we're going to ask, are you thinking about killing yourself? And it's really important that we use those heavy words, those scary words. Keep them safe. Don't let them out of your sight. If they do share a plan that they have, and let's say it's firearms, do a check with them. Have them show you their gun safe. Make sure that it's locked. If they don't and they have guns in the house, find immediate help, whether it's a family member that can take them and lock them up in their home. If you need, call and ask for maybe some support with the police officers in town, and just letting them know it's not an emergency, but you just need some additional support right now. Medication, that's another one. Making sure that meds are locked up. I know at the CARES Coalition, they do a lot of drug take back days, which is coming up on the 27th. And that's over, is it still over? Police department. So that's an option to get rid of any of those extra medications that you have lingering around your home that could become a danger to someone else. Even though you might not think about it, somebody else that might be over visiting your house, or a friend of maybe a grandchild, you don't know. They might go into your bathroom and look in the cupboards. So making sure that you have your medications locked up. The CARES Coalition also does have lock bags and lock boxes as well. So make sure to reach out if that's something you guys would find to be helpful. The next one here, I think we lose sight of this one. It's being there. And what it means to be there for someone is to listen. To listen, but not to fix. Listen, but not to tell them what to do. They're hurting. Let them know it's okay to hurt. Let them know that it's okay to be mad. Emotions, we're humans, we have them. So if someone's having a hard time and they're struggling, or they made a mistake, or they did something bad, or one of mine was, I used to fall behind in schoolwork all the time. And when you get behind in something, it's easy to stay back from it. And then you keep getting behind and you keep getting behind. So if someone could just stay there and say, no, I've got your back. We're going to get through this together. Yeah, maybe you made a mistake. You fell way behind, but we want you here. We need you here on this earth. Let's work together to get through this. So listening. The fourth one is help them connect. So again, that 988 number is popping up again, or texting the crisis number, the 741-741, or reaching out to your medical health provider for a referral, or calling clinics directly to get help. At our clinic, we're the Psychotherapy Center of Waunakee. We're up by Culver's, a little too convenient. And we have a small wait list, but we don't need, or we don't require a referral from a medical provider. So that's someone you could just call, you could get put on the wait list, or you can go to our website. And a lot of clinics work that way. I know we have Stone Tree Therapy as well in town with CJ and Ashley. And there's a new one actually opening up on Main Street. And I forgot her name, but she specializes in trauma and substance use and a couple of other things. So there's lots of resources just in our own small village here. And then staying connected. Just because you bridge them to a provider, or you bridge them to a mentor, or to someone to help them through this, that doesn't mean our work is done. Let's keep building on them, because sometimes when they're done with those meetings, there's a lot of thoughts. And if they're going back to their home by themselves, or their apartment, and you're with all those thoughts, it might be nice to have a phone call, to chat with someone, and it's not even to get into the business of it. It's, how was your day? How are things going? You know, how was your grandson's game the other day? It's to have those conversations to keep them going. So according to the National Institute of Mental Health, just a couple of facts. So this is all based out of their recent study, which is actually of 2021. So what we know is that the numbers are actually probably higher. But with the data that they do have, suicide is the 11th cause of death in the United States. It's the second leading cause of death for the two age ranges of 10 to 14 and the 25 to 34. And for those age ranges, especially the 10 to 14, the first cause of death is just like accidental things, like flipping off of a boat accidentally, or in drowning, or a terrible fall or something. So literally, this is the second one for our adolescents. It's the third leading cause for death for ages 15 to 14, and the fifth leading cause of death for 35 to 44. And the wild part is ages 75 and beyond, they're the ones struggling right now. Them, the 75 and above, and our adolescents, the 10 to 14. So it's the two opposite ends of our spectrum right now, which is scary, right? Because those are the two that are isolated a lot of the times with emotions. They're not the ones that are at work every single day with colleagues and people they trust and being able to communicate. They're the ones that are maybe learning to walk again, maybe learning how to get through their day, or experiencing a death of a loved one, but then they're alone. So it's really hard, and we really need to make sure that we're engaging not just the young, but also the elderly as well. Nearly 2 times as many suicides in 2021 as there were deaths. So it's 50,000 suicides, roughly. It was like 49 something. And roughly it, 20, it's per, the data was like per 100,000 people or something. I don't remember the exact, but it was double. And I thought, wow, that shocked me. So the next couple of slides are just going to be breaking out into some statistics of looking at the suicide rate. So here we can see the 75 plus category at the top. That's our highest. And that the male, the 42.2, that's the male side. So the right side is for males and the far left side is females. So then you can see the age range of 45 to 64 is the highest for female. This one is going to look at the ethnicity and race and the breakdown, again, with male and female. And we're starting to see a large increase in the American Indian and Native Alaskan and Pacific Islander category. Not Pacific Islander, sorry. So this one, down here, the American Indian and Alaskan Native. So we're seeing a huge increase in that population. And then you can see as well, white males is also pretty high. So this is a breakdown for states, again, 2021. And you can see Wisconsin is smack dab in the middle when it comes to where we are on the map as far as suicides. You have states like Illinois, California, New York that are pretty low. And then you get into some of the higher states, which kind of like in the middle there by like North and South Dakota, Montana, you're looking at it to be a little bit higher. Anything about these first couple of slides? Any questions? So here are the resources. So you have the 988. You can go to 988lifeline.org as well. They have a crisis text line, and you can write hello or home to it. Different sources will tell you different, but they both will answer. Here in Dane County, we do have Journey Mental Health, and they run our crisis dispatch. and work with police officers, work with anyone to come out and do calls. So it's not always just the police that are going to be showing up. So you can always reach out to the 24-hour mental health crisis line. And then obviously 911 are going to your nearest emergency room. I put us down, the Psychotherapy Center of Wanakee, and then also Journey Mental Health in Madison.